It's more than 15 seconds. Let's just go for it. So,
Yep.
good afternoon. How are you?
I'm doing well. I'm excited.
Oh,
It's
see the
St.
excitement
Patrick's
on your
Day.
voice.
We get to have fun. I'm excited because of all the energy that we get whenever we're working with the viewers. So as you guys come in, say hello. Let us know where you're coming from. We want to hear from you.
Excellent, exciting St. Patrick's Day today. So that's really fun. Another big deal. Next month, that's like massive. 100 years ago, another Dr. B and Dr. B, Benting and Best. I'm not saying anything about myself. 100 years ago, they discovered insulin, crystallized it enough and used it in a patient. So that happened just about 100 years ago. Big deal. Exciting times. And you have something to share on a recent Facebook poll about today. What happened?
Well, first, I mean, St. Patrick's Day is happening, but we do have visitors all over our office.
Oh
So
my
we've
God.
got some sort of mischievous fellow following us around in our office. And so just wanted to share with you guys some of the fun that we're having.
And
So,
that's the right one is my office. So he must have stepped in here. I
yeah,
see some damage here. So
he is creating
yeah.
chaos today.
Just
So cute
welcome.
little story before we get into things today. My 5-year-old was at home trying to hunt leprechauns. So I really hope that she's watching this and she sees where the leprechauns are.
Excellent.
Yes, I do. I have some Facebook information. I'm going to skip through
You,
these
no, not this, but
quickly. I'm going to go to this and talk about what devices. So we asked everybody on in our Facebook group, what devices are you currently using? So we've got most everybody answering that they're using, glucose meters. Next biggest group is sensors, and then we've got 4 users that are doing insulin pumps. So we will definitely be talking about sensors and insulin pumps today to increase knowledge and awareness about them.
well, hello to everyone. Rose and Casey and Matt. Matt is Jamie's other half, better half. No, other half, I mean to say. And he has said that she sees them, so that's good. Christine and Rohan, Tyler from Walkie. So, welcome everyone. Keep typing in your names. Keep chiming in. Excellent. By the way, if you are watching this later on, please know that if you can put in comments, and we will definitely answer them right away as well. So. Um, I think it's time to kind of get started.
Yep.
Right, Jamie? All right,
Yep.
let's do it. Welcome, everyone. And, what is today about? Well, today is about peace of mind. Did you know that people who use sensors in a study proved that they spend another 1.3 hours more in the normal range compared to baseline? So that's 1.3 hours is about 80 minutes or so, 79 or some whatever number of minutes. So that's kind of cool. So we'll talk about sensors today. We will talk about insulin pumps, and then we'll talk about different types of pumps and sensors and what may be right for you. Now, so to do that, it's a team of 3. I'm Dr. B, Dr. Bhargava, just very interested in changing diabetes for last 25 years and change. So excited to be here. Of course, Jamie Pidlick, pharmacist, professor at Drake, very passionate about diabetes. And then we have Marcus today, president and COO of Diabetes Equipment and Supplies from Grimes. So I think it's a team of 3 that's going to be here today to talk about these topics. So Jamie, here you go next.
Yeah. And now I'm going to go back. So if you guys can take my slides down for just a second. I just want to remind everybody out in Facebook, you guys have been doing a great job interacting with us and actually answering each other's questions. So it happened again over the last couple of weeks, where a group members posting a question and you guys are answering each other. And we want you to keep doing that. And the people that are the most active in our community are going to be eligible for the Community Engagement Award. So we'll give away the March one in 2 weeks at our next session. So we're just really excited to do that.
I have to add. We reached 600, more than 600 users over the weekend. That's pretty cool. And by the way, our Google reviews have almost doubled within the last month. So it's just, you guys are great. Thank you so much for joining. Thank you for inviting other people. And Google reviews, if you haven't done, please do. We would totally appreciate that.
So prior to this event, we wanted to bring back something that we did in that 6-week event, which was having you guys pre-submit questions to us. And I really like this. So we've had some that have been pre-submitted, and Dr. B, I'll have you take a look at this one. This is going to be somebody who's had type 1 diabetes for 35
Sure.
years and having something called lipohypertrophy. And it's like basically looking like love handles. And so what can he do when he's injecting insulin?
Sure.
In those
When
areas?
you inject insulin for a long time, especially in the same area, the insulin will start impacting the fat cells, either atrophy them, meaning less, and people will have dimples, or hypertrophy, or which is bulges, or dystrophy, meaning just lumps and bumps in that area. What that does is it really changes the absorption of insulin and makes it less predictable. So in that situation, you really got to avoid those areas for a few months. 6 months is what I recommend to my patients, and don't use those areas. So there is a lot of real estate you have for insulin, right? In all of your belly except the 2 inches around the belly button, the back of the arms, the thighs. There are many other places that you can use. So that's rotation is key. And over time, yes, these will go down, but it could be a several month process. Some of my patients, they just don't go away, but they definitely get better.
Yeah. Next question that's submitted, and I'll take this one. It has to do with medicines. We've got somebody said that twice now they've accidentally grabbed Novolog instead of Tresiba, meaning they gave themselves 35 extra units of Novolog. And what do you do when that happens? One, I like the very last sentence where the patients decided to get some colored tape and mark the Tresiba to make sure that they're always grabbing the right one. I would do the same thing. Colored tape, or I'll take a Sharpie or a marker and color something, make it obvious what's your long-acting insulin, what's your short-acting insulin, so that you can really help differentiate the two. Especially Novolog's going to be orange on the label, so if you can exaggerate that orange color a little bit more, that will help out. If you're accidentally taking too much of the wrong type of insulin, you're got to get fast-acting carbs in your system right away. So that's where you're going to have take a half a glass of soda, and you're going to take 15 grams of carbs in, and also take in a mixture that has longer acting carbs mixed with protein in it. So something like a peanut butter and jelly sandwich might be a good option for this scenario, because that peanut butter is going to carry you over and keep that sugar higher longer. And then it's just keeping track of your sugar. So after you figure out you've made that mistake, go get extra sugar right away. And then in 15 minutes, check your sugar. And then every 30 minutes, I would recommend checking your sugar and keeping track of that to make sure it's not getting lower than 70. If it's starting to dip low and definitely going below 70, it's getting another 15 grams of sugar in you with those fast-acting sugars that I talked about.
Cool. One thing I might add is keep your insulin injections, the pens, in different places. Your mealtime insulin in your kitchen, but your long-acting somewhere else. That's another way to think about. Cool.
Yeah. Now, this last question, I'm actually going to bring in Marcus for this one.
Because it's not my fault. I don't even know anything about this. So, yeah.
So, Marcus, essentially what I'm understanding from this question is they're getting a sensor, and that sensor lasts up until their last sensor ends on like the day that their new sensor arrives. And is there any way to help patients out so that they don't feel that time crunch of, and what if the mail doesn't come that day, so that they're not missing out on days of therapy, essentially?
Yeah, I think it's a great question, and obviously very common. Dr. B, you are off the hook. It is not related at the clinical level. It's really related to insurance. One of the strategies that have been employed that seem to mitigate this is upon your initial transfer over to the equipment, allow yourself 2 to 3 days before using the equipment, because that becomes your anniversary date, and your equipment will arrive each month. And that allows you upfront to build in those excess days. Unfortunately, it is related to insurance, and that's going to be tough to change. We hope they catch up at some point.
Tyler mentioned how he deals with it more with Dexcom. So different companies are different, different vendors are different. Some may have some leeways to support in some of these things, not all of these things, but definitely you got to try. And my wife uses Omnipod and Dexcom, so she would have trouble with Dexcom quite a bit as well. So
yeah, good point. If there's an issue related to the sensor, then we generally receive those calls and direct to the manufacturer. And you're exactly right. If there's an issue with it, otherwise, if it's just related to 31 days in a month, then you've got a 30-day supply. That's where we kind of recommend that forward management upon initial transfer to the equipment. Good point.
So Jamie, I have a question for you.
Yeah.
Medications are given for 30 days, so 5 days a year. What are patients supposed to do with their medications and pills?
And so it's based on number of days. And so it's not based on month. So in the pharmacy, we're keeping track of the number of pills. And so if it's 30 days given and they got it on March 1st, they're going to get it on March 31st.
Okay.
And they actually allow a couple of day leeway in the pharmacy so they can refill sooner than when it's actually out. Yeah.
All right. Cool.
Yeah. So Kelly, I saw your question about talking about Omnipod. We will cover that when we talk about pumps later. So we definitely have some points and different things as we're going to talk later. So Dr. B, we've got a quick poll for the audience. So I want to hear from everybody. What are your challenges when you are monitoring your blood sugars? Let us know. Type it in the chat because we want to address some of the things that you're experiencing as you're checking your sugars at home.
Yeah, I personally was on sensor for some time just to check all of them out. And then I also checked sugars from time to time. So yes, I actually didn't check my sugars as much as I wanted to, like in front of patients and stuff. Sensors were relatively a breeze. So that's kind of my experience with checking sugars. But please type in, folks, what prevents you from checking sugars? What's your pain point?
Casey's saying needles. Yeah.
So, folks, from an audience standpoint, are we okay? Is everything going live? Because comments-wise, we usually get a ton more. So tell us what prevents you from checking sugars. And Leanne, obliged. Because I'm not taking insulin, I don't qualify. However, I test before breakfast. And if I'm over 150, I don't eat breakfast yet. So I would benefit for knowing what my sugar is to help maintain healthier sugars. So her question is, how can she qualify for more strips? Marcus, you have any thoughts on the limitation Leanne might have and how to approach those?
Yeah, no, the testing frequency is usually a key component of authorizations required by insurance to get that. Now, it would kind of depend on exactly who you're working with. But generally, if your physician is supporting a certain quantity, then we can work with an insurance company to get that. But it's all under the umbrella of control for the insurance companies, and your physician can definitely help.
Yeah. And there's times when even with the physician's help, we can't get the quantity that the patient might need. And sometimes for those, Dr. Bhargava, we will do, I think, like paired readings, right? So one day we might say, check before breakfast, check after breakfast. And then the next day we might suggest check before lunch and after lunch. So there's different things that patients can do, but working with your provider on how to help you through that, I think is the best thing.
Yeah,
We've got some more
there are ways that you can make your strip work harder and smarter for you, right? So the paired readings is great. Sometimes we would do a 360 analysis, 3 days only before you see your doctor, but 7 sugars each day. So hopefully you have collected enough. So there are different ways to make this pain go away. There are a few other comments here. Christy says finger sticks multiple times a day. Um, Tyler, deciding which sugar level to go off of what meter shows or what sensor shows. Yes. That is the discrepancy, and we'll talk a little bit more about this. But that's a challenge in whom do you trust, and I think it's I wish I could say one is more accurate than the other. In general, you have to take that clinical situation. But we'll talk about the sensor meter difference in a minute. Kelly, I think time is a perspective, busy at work. Rose, remembering to test before eating. So Tyler has a follow-up comment, and then Carla is saying, hey, I usually test every morning and only a couple of hours later if curious. So it's great. Thank you for this feedback. And I think blood sugars have a challenge. So I'm looking forward to some conversations on what's the next step after blood sugars.
Yeah, and so at this point, I think if you want to start covering like what is a sensor, and Casey and Morgan, if you guys can bring up that picture, I think that'd be great.
All right, so let's talk about sensors or continuous glucose monitoring. So this kind of the exciting journey of what I call the fluids. Remember many, many years ago, and some of you, if you were checking 30, 40 years ago, you might remember checking urine for sugars, right? And that was like the thing we got. And then came the blood sugar meter. And so we started checking in blood. Now, the next big advancement is now instead of checking in blood, we can check in this thing called interstitial fluid. This is the fluid just below the skin around the cells. And that correlates with the blood, but it's about 15 minutes behind. And that's a very important point, that the sensors are about 15 minutes behind your blood sugar, something to keep in mind. So essentially, you put this thing on every few days, every 7, 10, 14 days, depending on the sensor you use. Once you put in, there's a small filament or needle that is in the interstitial fluid, and that continuously checks the blood sugars. Every 5 minutes, it relays it to a to a receiver. So there's a sensor, a transmitter on top, and then a receiver. A receiver can be a dedicated receiver or a iPhone or Android, depending on. And we'll talk about these differences. So this is kind of cool and exciting that now you are able to know your sugars without poking, and you can know them continuously. So there are some advantages to using sensors, right? A blood sugar is just a point in time, while a sensor is now, it gives you ups and downs. So the trends. So if my sugar is 150 before a meal and I'm going up, I'll do something different. If my sugar is 150 and rapidly tanking down, I'll do something different. So this idea of having the direction, like, hey, which way am I going? Convenience, I think, is a big deal. The frequency is a big deal. With some of them, you swipe. With some of them, it just sends to the receiver directly. So a lot of different benefits. Jamie, what would you add to benefits?
I think some of the benefits I want to speak to that the patients have actually, or the viewers have actually touched on. Needles, right? So Casey had mentioned needles are a barrier for her. And Christy's asking, does the needle stay in my arm if I wear the sensor? No, it's one poke for some of these 14 days. And then it's just this filament that sits in your arm, and you're not having to poke anything. And you're not able to feel as much what's going on. Yes, you're going to have something on the outside of your arm or on your stomach, but it's not going to be painful for most people. It kind of goes in and then it's straight out in the delivery device. So the other aspect that you talked about was, like the time, right? You're never having to stop what you're doing, wash your hands, get out all your supplies, take your meter out, take your test strip out. It's a quick look at my reader or look at my cell phone, and boom, there's my blood sugar. And then there's the direction that my blood sugar is going. So some of those barriers that you guys talked about, that can be helped with a sensor and increasing your convenience. Let me share this next slide with you. I think it goes through some additional benefits. Dr. Bargava. And I think we've got another poll as well. So how comfortable do you guys feel with diabetes devices? Meaning how much of an understanding. So very comfortable, somewhat comfortable, not sure, uncomfortable, or very uncomfortable. So let us know how you feel about those. And then we can start talking through some of the other things as well. I think my slides, the slide I want to get to is elsewhere. So give me a second while I bring up the right slide.
So I'll talk about from a benefit standpoint. We have done numerous studies with sensors here, and we're very lucky to be part of this diamond study that you'll talk about in a minute. It was gratifying to do that here. For a long time, we thought of sensors only for pump patients. And then studies like Diamond came up where it said, hey, is there a benefit for patients who are in multiple shots? So we did the study here, and it's just gratifying to see the results. So Jamie, go ahead.
Yeah, and you can talk through this as well. So there are benefits with the A1C reduction. Yeah, go ahead.
Yeah. So the key benefits, first of all, we discovered and proved that even people on MDI, which is multiple shots of insulin a day, that the presence of a sensor reduces A1C significantly.
Yep, hold on.
Next slide. This is important, right? This is the major benefit that I was talking about earlier. When you know your sugars, when you are seeing the trends, when you can be alarmed about them, which is another benefit of these, then you tend to spend less time in low and less time in high and more in this target range of 70 to 180. Improved health. I think there's definitely, as you reduce your A1C, as you get these peaks and valleys better, you will improve your health. And lastly, the peace of mind. So sensors do have value. Jimmy, who are the patients who should use sensors?
You know, I think there are so many patients that could get benefit from a sensor. I think that anybody who is new to diabetes and wanting to learn about how their body is reacting to food, how their body is reacting to exercise and the different medications that they're on could actually benefit from a sensor. What do you think, Dr. B?
In terms of, I was reading the comments, so.
In terms of who do you think should be on a sensor?
Yes. So I think, first of all, patients on pumps, surely. Second, patients who are on multiple daily injections. So my rule of thumb, a general rule is, hey, how many times should I check my blood sugar? One more time than the number of shots you're on. So if somebody's on 3-4 shots of insulin a day, I want them to check 4 or 5 times a day. And that's a lot. So for those people as well, and the Diamond study, which we were part of, is kind of a testimonial to that. Now, when it comes to somebody on 1 shot a day, I'm not so sure. I could be convinced this is an area where I need more benefits than the medical side. So one of the things I'll point out about sensor is it's not just a tool for monitoring sugars, but it's also a tool for monitoring behavior and getting instantaneous feedback on behavior. So let's say somebody had pizza and then they remained high for the next 12 hours. You know, next time they'll think about. So this is one big aspect of sensors. So I think there are people in whom I would use them if the idea was that this will make a significant impact on their behavior.
Yeah, and that's where I think those very motivated people, even if they're not on very much medicine, that's where I would argue that they could get that benefit, especially if they're really trying to hone in on their diet and they're changing their diet or exercise behaviors. I really think those patients, if they're looking for that behavioral motivation, maybe not a lifetime of sensors, but a 2-week time period so that they can really learn what's going on, I think I would argue they would receive a great benefit.
Excellent. Well, there's a lot of comments we have glossed over, so I just want to go back to some of them. And people mentioned in terms of comfort, we saw 2s and 3s. one as well. And I think these are your friends. The sensors, pumps, and device, all of these are your friends. The more comfortable you are, the better. I loved Leanne's comment about the Dario. She uses Dario, and it shoots the sugar to a website and portal, so she likes that. But yes, strips are expensive. I think there was a question about Libre 1 and 2 from Laureen. We'll talk about that in a moment.
And there's a question on the glue. So Carla's saying that she has a reaction to pads on EKGs, and potentially could have a reaction to some of the medical glue that's being used on the sensors. In my opinion, there could be a possibility of a similar reaction.
So I think it depends on the type of reaction. I think most likely these glues might be different because the purpose is different. Nonetheless, I think it depends on the reaction. If it was a severe reaction, then I would be perhaps leery. But if you had a mild reaction that went away, I think it's very reasonable to try. The value you get out of these sensors is so substantial that I would not prevent myself from trying them based on a past experience.
Yeah.
All right. Let's see. What else have we not covered?
Yeah, and I'm looking at Carla's doing a follow-up. She thinks the sensor would be a valuable tool. And she's making the point that she doesn't necessarily feel when you're high. And that's true for most people. Yeah, when you spike really high, you might feel a little extra fatigued or might feel a little dizzy. But the symptoms of high blood sugars are vague. And so that's why monitoring your sugar becomes so important. Let's see. And so at this point, let's bring Marcus in and let's talk about like the insurance limitations on who does insurance think should benefit from a sensor or a CGM.
Yeah, I wanted to get in and vote. I was going to say everybody should get a sensor because what I like about it is information. I think information is powerful. I think part of the pandemic, one thing we've learned is information, timely information to help drive better decisions. So my vote would be for everybody to have a sensor. But good thing we're talking about here is the insurance side of it. And what I wanted to do is just have a screenshot of what are likely the most restrictive when it comes to CGMs. There's 6 criteria that Medicare are going to require. And Dr. B, you hit on it as far as your expectation for usage for sensors relies on the frequency of testing as well as the insulin injection. So Medicare has some limitations. Now, fortunately, the doctor through the prescription attests to all of these. So from a patient standpoint, it's easy. The doctor has given you your prescription and you're kind of ready to go. There isn't any other type of authorization to go with it. So Medicare is going to be the 6 criteria, but it's easier that the doctor can attest to it. When you look at a Medicaid level is generally going to follow the Medicare, but here in Iowa, they actually have some additional criteria, and that criteria is a challenge. It's documentation for a period of time of those sugar logs. And I think, we talked about earlier some of those challenges for testing. That's what happens when we look at Medicaid coverage, is ensuring that the patients have those logs. So that's one thing to consider if you do have a Medicaid component. Then you go up to the commercial or private insurance. And really at that level, a lot of times the prior authorization or all the information isn't necessarily required to get the equipment. So we can navigate a little bit faster. Now, listen, there's a lot of nuances when it comes to commercial. There's even nuances within a privatized Medicaid world that we're in here in Iowa. But the idea is that generally Medicare is going to be the most criteria that you'll have to meet. So that's why I thought it was important that the audience be aware of that 6 criteria, but mostly just understand it's going to be that frequency of testing. The more you're testing, the more you're needing for insulin injections a day, the likelier candidate that you are for CGMs. And I think the other thing we talked about is I love the participation from your group, because it gives us a sense of, after I leave the clinic or the health care facility or the care of Dr. B, we try to be diabetic equipment and supplies. We try to be that strong bridge with that continuity of care, that patient-centric care from clinic to home to everyday life, because it is not easy. And getting your supplies quickly and accurately, and more importantly, on time. We kind of talked about some of those limitations that we have within the insurance industry and coverages. That's kind of where we come in, because we're experts. So we know automatically, what's happening, what's out there. We're going to talk about some of the therapies and equipment that are available today. And tomorrow, there's going to be even more, as well as alternatives. So it's a great time to, I guess, take the leap into relying on the CGMs, because of that beautiful thing called information that helps drive our better decisions. So I love today's topic. And, today I think mostly I can just be a resource for some questions as they come in. But you guys are doing a great job at explaining everything.
So the one thing that I've noticed in the comments, we've had that discussion about the adhesion reaction, and people are jumping in and giving each other advice. So I personally have never heard of this, but I think Sharon is saying use Flonase, which, based on what is the ingredients in there, it could possibly work. I don't have any clinical knowledge on that, so I'm not recommending it one way or the other. And then Tyler is saying that they have a whole selection of products. And Tyler, if you have that resource, feel free to send out a link to that. We can check it out and then see if it's something that we can put on our Facebook group or not. So love to talk about that.
I think Tyler mentioned he was maybe a Dexcom user. And so we do get this type of feedback about the adhesives. So yes, you can reach out to the manufacturer. So Dexcom, they'll help walk you through some of those options, because you're not alone out there. People are having the reactions. Manufacturers are aware of that, and they should be able to guide you as far as options for that.
So at this point, I think I'm going to quickly step through all the different types, and I chose the ones that are the latest on the market. So I know there was a question about Libre 1 versus Libre 2, and I will touch on it. But I think that this chart really guides kind of the big decision making for what patients are looking for. So as you're looking at this chart, I've got the different brands on the left hand, and the newest ones are going to be your Libre 2, your Medtronic Guardian 3, your Dexcom G6, and Eversense. So 2 out of these require calibration. Calibration just means you have to do a finger poke and tell the machine what your current blood sugar is by that finger stick. So Eversense is twice a day, Medtronic is 4 times a day, but even that is working to change. Libre 2, Libre 1, and Dexcom G6 are all no calibration required. You can do it, you can choose to do it, and there's a way to do it, at least for Dexcom, but it's definitely not required. They come out ready to go. Treatment decision means that it is FDA approved to dose insulin based on what that blood sugar currently is, reading on that sensor. So you can see 3 out of the 4 are FDA approved for a treatment decision. So Libre 1 and 2, G6, and Eversense have that. I've got the wear time for you. The biggest difference on the wear time is going to be the Eversense. Eversense is an implantable CGM. So this one, you actually have a procedure in a doctor's office where they go in and they insert this little metal sensor into your arm, and then it can be worn for 90 days. In 90 days, you have to get that sensor out, and then you can choose to put a new one in, usually on the other side. And then the last feature is talking about alarms and alerts. So will the sensor tell you when you're going low and alert you to that, or will it be silent? That is the biggest difference between Libre 1 and Libre 2. Libre 1 does not have alerts. It will not tell you if you're going low or if you're going high. Libre 2, you can choose to turn on the active alerts and alarms, where if you're starting to change super fast or your blood sugar is dipping below a threshold, you can pick the threshold. So if it's starting to go below 80, it will then alert you that you are going low. Libre 1 does not do that. You have to go seek out your blood sugar to figure out if you're going low or not. Libre 1, you can use your cell phone as a reader. Libre 2 eventually will have that option, but it is currently not FDA approved. So Libre 2, you have to use a separate reader. It cannot be your cell phone.
So, Jamie, I was very involved with the Libre many years ago. I used to go to Dallas every 6 months and spend time. And at that time, our vision was to make Libre as affordable as 4 finger stick a day. And there were times I did not necessarily believe that, but it's really heartening to see that the company achieved that. And it's just awesome. It has been great to be part of that, building that whole thing, talking about things every 6 months, and pursuing this vision. And they really achieved it and done very well in terms of becoming a meaningful and likely replacement for finger sticks. So very cool. So that's kind of the sensor coverage. Shall we move to pumps? I know we're
Yep.
kind of behind that time. And so tell us, how familiar are you with pumps? And your choices are, you could be very familiar, somewhat familiar, not familiar at all, and nothing at all. So tell us, we just want to gauge our audience. And while you're talking, we can talk about insulin pumps. So what's the idea of an insulin pump? So the idea of an insulin pump is that, remember, I talked about the insulin multiple shots, a long-acting shot and a short-acting shot. With a pump, you only use a short-acting insulin and deliver it in two ways. One is this baseline insulin all the time, called the basal. And then with your meals or for your high sugars, give these boluses. And so it really replaces both of your insulins. Like one of our audience had problem mixing the long and short. Here, there's only one insulin, short-acting, which is delivered different ways. And these were a major advancement for our patients with diabetes. I remember many years ago going to Medtronic headquarters and seeing that first big pump. And now look at the sizes of these. These are pager size, and Omnipod, which is a tubeless pump on the left, is even smaller. So pretty powerful. Typically, who should get these? Typically, people who are on multiple daily doses of insulin. That's really the people you want to change to. Type 1s, most of them are on MDI. For those, I say that the insulin pumps are the standard of care. I really try to move all my type 1s to pumps, and many type 2s who are motivated and are doing those 4 shots a day. So lots of advantages, better diabetes control. Multiple studies have shown that. The flexibility, our basal insulin rates are not the same all day long. Sometimes we need less, sometimes more, and the pumps can do that. There's something called the dawn phenomenon, which is about 2/3 of people have that. Early morning, our sugars rise. Insulin pumps are the only way to address the dawn phenomenon. The math, how many people love math here? There's a lot of math in diabetes, right? I'm eating 35 grams of carb. What is 35 divided by 8? I can't remember. Now, the pump can do all of that. It can add your correction factor-based things. So it takes the math away. And then instead of thinking just in units, it can give you 0.5 units, 0.2 units, and things like that. It can reduce the occurrence of low sugars, high sugars, and so forth. And now what the beautiful thing is happening is what we call completing the loop, which is basically you have a sensor which senses the sugar, the math in between that keeps becoming more and more sophisticated, and then the pump on the other side, which is then delivering the insulin. So now we have these closed loop systems, and we have researched many of them here. And it has been lovely to watch the Medtronic 670G or the Control IQ from Tandem, or right now we are conducting a clinical trial and some exciting data on combining Omnipod and Dexcom. So just lots of advantages. But Jamie said she'll be the devil's advocate. So Jamie, why not pump? Or what are the challenges with it?
This is not going to be something that you can use and then forget about your diabetes. With a pump, you still have to be active. You still have to be engaged in your diabetes. So you still have to type in what your, even on the newest ones that mix the sensor with the pump, you still have to tell it when you're eating and how many carbs you're eating. It's still not taking away some of that. And I say you still have to be engaged because you need to be able to troubleshoot. So if the pump stops working because the insulin gets clogged in the tubing, you need to be aware that that's happening by monitoring your sensor or monitoring your blood sugars if you're not on a sensor at that point, so that you know if your blood sugar is going to start spiking. And then you have to be able to troubleshoot, okay, where is the breakdown happening? Is it in my tubing? Do I need to change out my tubing? Do I need to redo my reservoir? And troubleshoot a whole new different issues. So you do need to take ownership in that. And as Dr. B likes to say, diabetes is a team game. Diabetes on a pump is an even bigger team game. So you're going to get a lot more education as you're going through this, with a lot more people. And so I really think it takes the right person to make a pump work. A pump is not a solution for everybody. It's a solution for the right person.
It definitely makes diabetes more manageable, easier, and so forth. But you still own the game of diabetes. And team-wise, we are all here. It's just that in pumps, you really need a more focused team that knows what they're doing. So typically an endocrinologist, a diabetes educator, a pharmacist, the whole team. And again, you are the key player in that team. We are out here to help you. And if you are considering pumps and it's something you're not able to get, you could see us at Iowa Diabetes Care. That's an option at our clinic as well. Carla has a question. My 43-year-old type 1 son uses Dexcom, and 30-year-old type 1 uses Libre, but only know through them as adults. So these are being used for kids as well. A lot of these technologies get started in adults and then kids, but really we have great evidence and great usage for these devices in kids. And the peace of mind for parents is huge. That they could go to sleep and if the kid will go low, that they'll get an alarm on their devices. So that's a big deal. So in terms
I was just going to add, we do a lot with children in children's camps, Camp Herdco here in Iowa, and the relief those parents feel when they have the information. We have a staff member here who checks on her 25, 26-year-old daughter. She's still connected. So when you get back to that teamwork, the technology allows others to support and be involved in what you're doing. Now, it's still tough, right? If you have the information, do I look? Do I not look? Do I worry? All those other things. But at least you have the information.
Now, I just quickly want to go through slight differences between the three main models of pumps that are on the market. And before I do that, I did see a comment from Lorraine asking about a Libre 2 sample kit. She doesn't necessarily want to use the reader and is asking if the Libre 2 sensor will work with her phone. At this point, it won't. There's no Libre 2 app that will link to your sensor. So you'll still have to use that sensor you got in the sample kit until that app is FDA approved. It won't work. So if you guys want to bring up that slide again that shows the differences between, and Dr. Bargava, feel free to jump in at any point. But as I look through these three models, they're not the only ones on the market. They're, I'd say, the most popular ones on the market right now. So I'll start on my left-hand side and go through the Omnipod. Right now, Omnipod is the only tubeless pump on the market. So if I look at it, there's none of these tubing systems. And so there's not a long cord between the computer and where the insulin sits. The insulin is actually sitting right in the pod itself in here. And then this is transmitting data with the personal delivery device. And that's now going to be a cell phone. Before it was a different device that they can change the basal rates and then deliver the insulin, but they still have to push buttons on here to tell this pod to deliver insulins. And you're going to have to change this pod out depending on the amount every 2 to 3 days. And I've got an information sheet that was pushed out to the audience that's going to have very specific details on the differences. So it's going to tell you how much insulin can be put in each of these different systems. I'm not going to go through that here, but that is out and available to you. As I look at the Tandem pump is in the middle. Tandem's pump is interesting. When it first came out, I really liked it. It kind of reminds me of a cell phone touch screen as I'm working on it. And it actually the software can be updated without changing out your hardware pump. Now, I believe they will charge you for some of that software updates. When it first came out, they weren't charging for some of those, and now they are, I believe, starting to charge for them. In addition, Tandem is combining its delivery with a Dexcom. So you can use your Dexcom to sense your sugars, and then with the programming of the pump will adjust your background or your basal rates based on what your blood sugar currently is to maintain tight control to a target blood sugar of 120. Medtronic is using its own sensor. It's going to do something similar where it has a sensor and a pump, but it's going to do it with a Medtronic sensor and a Medtronic pump. So it's kind of all within the same brand that can do something similar to what the Tandem is. And it was the first to the market with this type of technology with the Medtronic 670G. They've now released a Medtronic 770, and hopefully within the next year we'll release another model called the 780G. And there are some different benefits to both of those models.
So let me add this.
Yeah.
Let me add, I think there are these choices. Work with your doctor on which one is best for you. These are expensive, so something to keep in mind. If somebody wasn't sure, don't want to invest in this technology and just want to know, probably Omnipod is a safer bet. The upfront investment is not as much. Marcus, do you have any idea if we looked at 4 or 5 year costs of each of these? How much is it, the cost for each of these three? And are they comparable, different?
Yeah, it's a great question. And I think to your point, a lot of it comes down to the components of it. So the one thing Omnipod has is it has a reservoir as well as a sensor, as well as a transmitter all in one piece. Then you have a reader, which hopefully we can be using a cell phone as opposed to an FDA approved reader. But the more components you have, that's going to generally drive up your costs. So the less components over a period of time are going to be cheaper. Overall, what you're seeing is a transition from a 3-component CGM, meaning a sensor, a separate transmitter, and a reader, to 2 components. So a Libre is a good example of 2 components. The transmitter and sensor are 1 unit. So once again, that from a cost standpoint will be a little cheaper. So the vision is, I believe, you'll start seeing CGM all be 2 components with the combination of a sensor and transmitter. And then I believe, Medicare is going to require an FDA separate device. I get that, but private insurance, commercial insurance, and even some Medicaids will allow the non-FDA approved device, i.e. your phone, to be used. So I think the costs are going to start aligning themselves better. I think they're getting more efficient. I hope that kind of answers the questions. That's kind of a large look at it.
Know more about pumps per se. Omnipod has less upfront cost. The other two have more. But I think sensors is really what interests our audience more. So I think we are okay. I think we are getting closer to the end. So Jamie, what you got?
I think, Tyler, thanks for providing your recommendations on the adhesive reactions. He answered us with some of the things that he's used in the past. So thank you for providing that. That's awesome. The one other thing that I had was I just wanted to provide a quick resource for anybody who is thinking about doing one of these type of things. There's a website called Diabetes Wise. And if you guys can share that in the chat, it's Diabetes Wise, and you can take a quick survey there. It's about 4 to 5 questions. And it's based on what are you currently doing, and would a pump be your next step based on what your goals are with your diabetes. So it's a very personalized experience for that. It's a great resource. A lot of good information on that website.
Great. We'll post that information. Tyler, those photographs you could put on our Facebook group. That'd be great. So thank you, everyone, for joining today, and Marcus for joining and helping us navigate something that I don't know anything about, the insurance world. So thank you to you and your team in Grimes. Jamie, the key takeaways, what you got for the audience to remember?
I want them to remember that sensors could be a great option if you're looking to get that behavioral aspect and really help keep good control of your sugars and help in that peace of mind. It's going to be my key takeaway.
All right, Marcus, what you got? What's your message to the group?
Yeah, my message to the group is you do not have to be an insurance expert in order to be supported. So we talked about the fact that Dr. B says it takes a team as you kind of increase in your level of technology that you're using. So today I hope to just give everybody an understanding of insurance, kind of the expectations. But always feel free to call the experts, and we're happy to do that for you and to support you to make sure that your life's easier when you get home.
Right. So from my side, these are amazing tools. Diabetes, there has been no better time to be a patient with diabetes. These are amazing tools. These are like the weapons in your fight against diabetes. You still have to use them, but I think they can really make your life much easier with diabetes and much better control of diabetes. So I just I hope that you all feel optimistic about the future with all these different tools that are just designed to help you better manage and control your diabetes. Jamie, I'm going to turn it over to you and go from there.
Thank you guys so much. I love all the interaction. Thank you for joining us today. Thank you, Marcus. Everything that you provided was great. It's amazing to have a resource like you right in the Des Moines area. So that is awesome. Just quick announcements for what we're coming up in 2 weeks. So one of the most common questions we get on through that whole Facebook challenge, the last 6-week challenge of the first part of the new year was, I want recipes. I want help knowing what to cook. We heard you. We are bringing in an expert. So Casey, please bring up the slide. Are you there? Can you bring up the slide? We are bringing in the expert of doing the delicious diabetes dishes with Chef Robert Lewis. Oh, you want me to screen share? Great. Sorry. There's always something. Sorry about this, guys. We want you guys to do the delicious diabetes dishes with Chef Robert Lewis. So we heard you guys, and we are bringing in the Happy Diabetic. He is a chef. He does have diabetes, and he has a passion to use simple ingredients and make them tasty and healthy. So we're going to have him on for a couple of these sessions, but in 2 weeks is going to be our first session with him. So super excited to share that with you.
Excellent. Folks, keep up the energy on the Facebook group. You guys are doing amazing. 605 members. I mean, this thing is growing crazily. I'm just super happy, and the support you're providing to each other is amazing. So keep doing that. Also, if you get a chance, give us a Google review. And I think that's everything. Thank you so much for joining us in this fight to change diabetes. Have a great St. Patty's Day, and see you in 2 weeks.
Thanks, guys.